Hi everyone, Panda. All right, today is a request for topic, and it is on delirium. It's actually it's from a request from a police officer who's looking at delirium, and I thought that I could give it a little introduction. So this is part one of delirium. A disturbed Thus, the dictionary definition is a disturbed state of mind or consciousness, especially an acute, transient condition associated with fever, intoxication, and certain other physical disorders, characterized by symptoms such as confusion, disorientation, agitation, and hallucinations. Delirium is a serious change in mental abilities. It results in confused thinking and a lack of awareness of someone's surroundings. The disorder usually comes on fast, within hours or a few days. Delirium can often be traced to one or two more factors. Either it's natural delirium or it's caused by recreational drug, which I will talk about in the next episode after I research more on it. First, it can be caused by a change in the way the brain functions. There are many things that can trigger this, including infection, urinary tract infection, UTI, and chest infections. Prescription medication as well. Delirium can be a side effect of a sudden withdrawal. Delirium is pretty common, showing up in about 80% of patients in the intensive care unit and up to 1/3 of all patients staying in the hospital. Symptoms of delirium include inattention, lethargy, confusion, problem with awareness, hallucination, and mood changes. And now we move on to delirium and dementia, which I just mentioned. The most common cause of dementia is Alzheimer's, which comes on slowly over months or years. Delirium often occurs in people with dementia. However, episodes of delirium don't always mean a person has dementia. So, how long can a person live with delirium? Well, delirium has a poor prognosis, regardless of how well it is identified, investigated, and treated, especially in hypoactive form, which is a drowsy form. Half of those with delirium on general and geriatric medical wards will die within 6 months. That's from 2020. It's pretty sad. So, what is the final stage of delirium? Wow, this is a very sad topic. Delirium causing agitation in the last hours or days of life is sometimes called terminal agitation. The person may groan or shout in a confused way. They may be restless, fidgety, pull on their bed covers, or try to get out of bed when it's unsafe for them to do so. Well, let's just talk about this for a little bit. My doctor took me off of medication, thinking that I can deal without it. Obviously, I wasn't able to. I don't think I had delirium, but I dreamed about really crazy and sometimes scary things like God, the planet, the galaxy, I don't know if that counts as delirium or not, or if I had hallucination because I was off my medication. But anyways, I'm never going to be off again. I'm stable with the way it is. And I think that my doctor will never take me off again. It was hell. And, I think I did have delirium because, what they were saying earlier about right here, restless, fidgety, pull on their bed cover, try to get out of bed when it's unsafe for them to do so. I wasn't able to walk because my fibromyalgia, I didn't have the medication for it. So it was a very difficult journey, and it was lasted about 2-3 months. And that's when I got beat up. And they drugged me and raped me and beat me up. That's when it happened. And then my doctor gave my prescription or my medication back. And since then, I am very stable. So there you go, a little bit about me. Take care.